Welcome, everyone, to Community Chat. Today, we will meet Miss Bridgette Reid, a dedicated and experienced psychiatric mental health nurse practitioner for more than 20 years. She served as Assistant Director of Nursing for 3 years and also as a Director of Nursing for a prominent nursing facility for 7 years prior to becoming a private practitioner. So it's my pleasure to welcome to CRR Network, Miss Bridgette Reid. Now, would you please tell us just a little bit about your place of birth and your transition to the United States?
Well, I was born in Jamaica, Clarendon, Jamaica, in the town of Milk River. And I went to high school in Garden High School and went to business college in Kingston. Then I went to Teachers College in Mandeville, Manchester, Church Teachers College, where I pursued a teaching diploma business education.
Wow.
I later moved here to America, to New York, taught for like 3 months, didn't really like teaching at all. I mean, those kids there said decided to transition into nursing.
Wonderful. You know, I knew you were mental health, but I was interested to learn that you were also a teacher. Awesome.
Oh.
So, Miss Reid, as a very experienced and dedicated psychiatric and mental health nurse, as we said, for more than 20 years, please share some of those experiences as a mental health practitioner.
Well, we talked about me being a nurse for over 20 years, but for being a mental health nurse practitioner, it's just for 4 years.
Okay.
When I was working, I realized that there was a need for my services or for more people to do mental health, and I decided to go back to school for such.
Wonderful.
And it has been rewarding.
Absolutely wonderful. Now, is there anything you'd like to tell us about mental health? And if someone would want to get into that field, what is the process?
Well, you have to be a registered nurse, first of all. You have to have a bachelor's degree to get into universities that offers that course.
Right.
And I went to Walden University from Minnesota, and because I did that while I was working as a director of nursing. So it can be challenging if you have a full-time job. And yes, mind you, anything in nursing is always hard work, a lot of research and time spent. You have to get time away from your family.
Yes.
You have to put that aside because it takes a lot of dedication, a lot of work and research. Because we have people's lives in our hands.
Exactly, yes. And you all put in a lot of hours. I know that from having family members who are nurses, and a lot of training, obviously. Yes, thank you. So you were trained, though, as you say, in business, as a business education teacher. How has that helped you in your practice? Because I know you transitioned into having a practice of your own. So how did that help?
It helps with communication skills.
Yes.
Teaching requires effective communication skills to convey complex concepts to students. As a psychiatric mental health nurse practitioner, you also need to communicate with patients, families, and other healthcare professionals effectively to provide quality care. Also, for problem-solving abilities, teaching often involves solving problems, whether it's addressing students' challenges or designing effective lesson plans. This skill translates well to diagnosing and treating patients' mental health issues as a psych nurse practitioner. Also, organizational and time management. So managing a classroom and curriculum requires strong organizational and time management skills. Well, these abilities are crucial in the fast-paced environment of healthcare. Well, you need to juggle multiple patient cases and administrative tasks effectively. Also, understanding human behavior. Teaching involves understanding and adapting to diverse learning styles and behaviors. So similarly, as a psych NP, I need to understand human behavior to assess and treat
Yes.
mental health disorders effectively. Another area that we can look at is also leadership and teamwork. As a teacher, you often work with colleagues, administrative staff, and sometimes parents ensure the students succeed. The same thing, these teamwork and leadership skills are valuable in collaborating with other healthcare professionals as a psych NP. So while the two roles may seem unrelated, teaching and being a provider, at first glance, the skills acquired through training as a business education teacher can complement and enhance my abilities as a nurse practitioner.
Wonderful. So those two separate careers really work well hand in hand. Yes, that's awesome. So tell us then, upon transitioning to psychiatric nursing, you decided to establish your own private practice, as I alluded to earlier. What are some of the pros and cons, though, of having your own business?
Well, right now I do work for a company sector on a W-2 job, and I had just started my own practice. And one of the things that I noticed that is good, the pros, that talk about the pros first.
Yes.
Just autonomy. I have control over my practice, including scheduling, setting my own schedule, choosing my patient population, and determining treatment approaches. This autonomy can be rewarded both professionally and financially. Also, there's another pros is flexibility. Running my own practice allows for greater flexibility in terms of work hours, vacation time, and the services that I offer. I can
Right.
always tailor my practice to fit my work style and professional preferences. There's also financial rewards. With proper management, owning a
Yes.
practice can be financially lucrative. You have the potential to earn more than you would as an employee, especially if your practice becomes successful and attracts a steady flow of patients, which I am working on right now.
Excellent.
So practice, yes, patient relationships too. So
Yeah.
running our own practice allows us to build long-term relationship with our patients. This continuity of care can lead to better outcomes and patient satisfaction. So we don't have to jump from one patient to the next and not have continuity of care.
Right.
It also offers professional growth. So owner practice can provide opportunities for professional growth and development. We may have the chance to expand our services, collaborate with other healthcare professionals, or pursue specialized areas of interest. Now, those are the pros.
Yes.
Now, let's look at the cons of having our own practice.
Yeah.
Now, we know we have the administrative burden. Managing a practice involves significant administrative skills, including billing, scheduling, have compliance with regulations, and handling insurance issues. And this can be really time consuming and detract from patient care.
Yes.
And yes, also start and maintain that practice requires significant financial investment. Mind you, thank God that I have a W-2 job
Yeah.
because then it can use to fund my practice. There's also the risk of financial losses, especially during the initial stages when you're building your own patient base. It also having your own practice too can be isolating, especially if you're the sole provider. Like in my practice now, I'm the only person. You may miss the camaraderie support of working in a larger healthcare organization. Another thing that is another con is as a practice owner, you're responsible for ensuring compliance with various legal and regulatory requirements that the state or the country may have, and failure to comply can result in a lot of fines, legal penalties, and even loss of your license.
Yes. Yes.
Yes, work-life balancing the demands of running a practice with personal life can be really challenging. And for me, I have my parents still reside with me, and my daughter. She's a teenager, and I'm telling you, she has so much activities, dance here, theater here. I mean, my whole weekend is consumed with this child. So the hours and stress associated with managing a business can really take a toll on our well-being if not managed properly.
Yes.
And yes, and ultimately, on your own practice is right for a person depends on your personal and professional goal, the risk tolerance, and the willingness to take on responsibilities and challenges. Being an entrepreneur is a lot of work.
I can imagine. Wow. Thank you so much, Miss Bridgette. You gave such a thorough explanation of the pros and cons of having your own business. And this is helpful for anyone out there who might be thinking of doing what you're doing, to switch to their own practice. So that was brilliant. Thank you. I appreciate that so much. And I'm sure our listeners agree with me. Now, tell us, why is ongoing education so vital in your particular field, you think?
Well, ongoing education is crucial in mental health for several reasons.
Okay.
One of them is to stay updated. The field of mental health is constantly evolving with new research, treatment modalities, and best practices. So ongoing education ensures that we as mental health professionals stay abreast of the latest developments and can provide the most effective and evidence-based care to our patients.
Right.
Also, it enhances our skills. So content education allows us to enhance our clinical skills, expand our knowledge base, and learn more therapeutic techniques. This enables us to better meet the diverse needs of our clients and provide comprehensive care. Another thing too is for our maintaining our licensure. Many licensing boards and professional organizations require mental health providers to complete a certain amount of content education credits. I know I had to do 40 hours just to renew my license to get my certification every 2 years.
I can imagine.
So ongoing education ensures that we remain in good standing and continue to practice legally. If that's not done, then your business that you work so hard to start and to keep can lose it. Another thing too is our ethical consideration. So ongoing education also includes training in ethical principles and guidelines. This helps mental health providers like myself navigate complex ethical dilemmas. We have to remain professional boundaries and uphold the highest standards of ethical conduct in our practice. It also provides opportunity for us to enhance our cultural competence and sensitivity because we treat a wide variety of people from different cultures, different backgrounds, and it's essential providing cultural responsive care and effectively serving our clients from diverse backgrounds. It addresses burnout. And still professionals we are susceptible to burnout due to the emotionally demanding nature of our work.
I can imagine. Yes. I can only imagine.
It helps us to develop coping strategies, self-care practices, and resilience skills to prevent burnout and maintain well-being. So we're trying to help our patients to deal with all of this, but we ourselves have to stop and take a breath and take care of our own mental health because it can be demanding and stressful.
Yes. And you guys are actually dealing with real life and death issues, literally, with suicides and so on occurring. It's really important that you all continue the learning process, right? And how to deal with some of those things.
And take care of ourselves.
And take care. Like they say on the plane, you put that on, on first, the mask on first.
For somebody else.
Yeah, before you can help, right? So well said. Now, I believe, it's just my personal opinion, that mental illnesses seem to be more prevalent in current years, especially among our young people. First of all, my first question is, do you agree with that statement? And my second question is, what do you believe may be the root cause?
I honestly think that's true. I look at agree with that statement.
Okay.
It's like they're so involved now, and social media. And there's so much exposed than we were, and no matter whatever generation it is, they're more exposed now, and so they have a lot of pressure. We did have pressure when we were going to school, yes, but now it's even more so.
Right.
And there's not a single root cause, but several factors have contributed, including the societal pressures, the
Yes.
economic challenges, social media influence, and also the increase in awareness leading to more diagnoses. And it's complex issue with no simple explanations. So training as a site provider provides us with valuable skills to handle these cases.
Do you think, this is just a question, you don't have to answer it, that the children taking, social drugs, in a fun way, so has helped or helps to cause some mental illness? Is that something that
Yes,
they
I think
found?
so because they're so much exposed, and I know that we have the legality of marijuana, and
Right,
in some states, and they don't understand that their brains aren't developed,
right. That's what I
and they're not
heard.
that taking using these can really cause more harm than good.
Yes.
And they are more exposed to medication. Mind you, some of them get treatment for their ADHD, for their bipolar disorder, and they may use those benzos or whatever they get from it. And they can get this treatment really accessible even in high schools.
Oh, yeah.
So
Yeah.
mhm,
It's
I've
easy to
treated
get.
patients, young ones who have been using drugs, I mean legal drugs, that is, and medication that's prescribed by a provider. And
Right.
unfortunately, sometimes they are given to by their parents.
Yeah. Right. To keep them quiet, to subdue them, as it were. Yes, it can be dangerous. All right. So, do you see, though, any improvement in the medical treatments that is being provided for patients suffering from mental illness? Do you see it getting better? Because I've noticed in some diseases that it seems as though the treatments are getting better and more effective. So are you seeing that with the treatments for mental illness?
I have with the stigma that comes with seeking mental health treatments been
Yeah.
more lifted in a sense, in that people are more prone to seek mental health treatments. They are more open to talk about it because persons in the media or the celebrities do talk about seeking treatment and therapy. Yes, there's been improvement. There have been significant advances in treatment of mental health
Yeah.
illnesses. There are new medications each year. There are new therapy techniques and holistic approaches which are continually being developed to improve patient outcomes and their quality of life. And additionally, there's a greater emphasis of personalized treatment plans tailored to individual needs. So each person that you may see, a patient you may see, you can tailor the treatment to match them. So it's
Right.
not like a broad, say, as a teacher said, broad care plan, or you're gonna have or teaching plan for this whole class, but each individual person you can tailor your treatment to help them.
Yes, yes, and that's very important. We're all different, right? We're all made up differently. So excellent. Well, I really love talking to you, so I'm going to ask you to just leave us with some words of encouragement. And before I go there, because we do have a few minutes, I want to say how much of a pleasure it is to know you. Thank you for supporting our events, and you were with us last year at our New Year's event. And girl, you can dance. You are a whole lot of fun. So you are very educated, very professional, but you also know how to get down. So it's always a fun. It's always a fun seeing you wherever I see you. Whenever we meet up. So
Yes,
thank you so much.
yes, it's
So
always fun going to those
yeah.
events with more mature folks, not just
Uh-huh.
people of my age or younger, but mature people from back home. That's awesome.
We're more fun, right? the older ones.
Mhm.
You know, I didn't ask you, and I just learned that you have a teenage daughter. So I didn't really ask you about your family. You want to tell us a little bit about that?
Well, I'm a single mom. I should say
Okay,
single because my daughter's dad is in her life, but she's
good.
13 years old,
But
and she's so much involved in everything in school.
awesome.
She's so resilient. I mean, doesn't need much help from me except money, the financial help for everything that she has up to pay for, and to
Yes.
take her all over the place. But she's involved in theater at school. She's also in the dance team. She was
Wonderful.
just inducted on Friday into the National Honor Society, which I'm really proud of
Oh,
her.
that's
Yes,
so nice. Big up.
yes, she juggles everything. It's awesome.
Excellent. Excellent. I'm glad I asked you. You know, it's nice. It's nice to big up our kids. You know, I love children. You know, being a teacher for so many years. You know, they are my heart. So now, as you
Yes.
leave us, as we're getting down to the end, I'm going to leave you to share some words of encouragement to the listeners. And also, if you want to give your number, if someone might want to call you, your practice, you know, you may do so.
Yes, so I encourage others by reminding them to seeking help for mental illness is a sign of strength,
Yes.
not weakness, and emphasize the importance of self-care, reaching out to loved ones for support, and staying hopeful that with proper treatment and support, things can and do get better. My
Wonderful.
my company's name is Beyond Psychiatry, and I provide help the patients virtually or also in office or in person. I see patients of all ages for psychotherapy and medication management. So you can always call me at 863 or 689-333-0303 at any time, and we can always make an appointment to see them. And also, I do see patients. I have the opportunity to see patients at CRR Network. There are
Great.
721 Verona Street in Kissimmee.
Wonderful. Wonderful. Thank you so much. And thank you for coming on. Thank you for sharing
Thank you for
with
having me,
us.
Joan. I appreciate it.
Yes, God bless you, and I know that you were a blessing to our listeners. Yes, it was wonderful. Wonderful, right, Mr. Witter?
Yes, ma'am. Always love her spirit. She's a
She's
very giving
lovely.
and caring person with her profession. And we love the fact that you really take this profession serious, because a lot of us, you know, as we say, we don't deal with our mindset. And to see that we have people like you, Ms. Reid, that provide the services is a great thing.
Yes, thank you
Thank you.
again.
Thank
Thank you
you.
for all you do. God bless and keep you and encourage you in everything you do.